This is Face to Face with Bimal Patel, a monthly conversation between the Hartford Healthcare East Region President and leaders and staff to celebrate our successes, update you on current events, share our vision for the future, and to get to know some of our staff face to face. This month, to mark Nurses Week, we celebrate the region's Nightingale nurses. 10 nurses from Bacchus and Windham have been honored with the Nightingale Award for Excellence in Nursing for 2016. Today, Bimal is joined by Nightingale Mary Withy, Debbie Cannon, Rachel Jadzik, and Nina Dunn.
Nightingale is a big thing, and recognition by colleagues is the best recognition one can get. I wish I could get that, right? I mean, so you all are, first of all, to be congratulated, but you're in an enviable position. When you are being recognized by your colleagues, that means that you're special among specials, right? That's what it is. So, first of all, I'm delighted to be here with you today. And everybody's done HRO training, right? And in HRO training, we heard a patient's voice that says, "Don't hurt me, cure me, and be nice to me." So our theme today would sort of rotate around that on our HRO principles and how we connect with patients and what drives you, etc. That is where the caring, compassion, and clinical excellence come into picture, parallel to the 3 HRO principles of how patient wants to be treated and what they're expecting from us as care providers. So with that note, I just wanted to start with Mary, you, since you're the furthest away there, is that your role as quality and safety for both of our organization here at Bacchus and Windham in our East region. It's a journey for you. You've been there. You're committed to this hard and grinding work.
In my role now, I am the person who looks at events when they happen. So, not great things that happen all the time. Sometimes they're near miss events. So we catch them with all of the safety systems that we have in place. But sometimes, unfortunately, they do reach the patient and often, for the most part, cause no harm. But now we're looking to find, something happened. Why did it happen? How did it happen? And what can we do to prevent that from happening again?
Rachel, if I could ask you about your Nicaragua trip and the differentiations that why you chose there and what's the motive and what drives you, and I'm just moved by your commitment to go to where probably the needs are the most. So tell me.
It's a little village, very, very remote, called Amatitan, and many of the people there this is the only health care that they'll get all year long. And it was moving. These people are so open and loving, and the children they don't know you and you're so foreign to them, but they climb right up in your lap and put their arm around you, and they just want love and attention. And I think that's what moved me the most, even more than providing the care that we provided there, was the bonds that we were able to make with these people. And to me, that's what life is about as a nurse, is bonding with our patients that we care for. I know in labor and delivery, that's always what I've tried to do, is make that bond with my patient and be their advocate.
Debbie, thank you for being here. And I just wanted to start by saying that your colleagues recognize you for your commitment and respect the way in which you treat your patients. And there is no better way to treat other human being other than respect, and I think you bring that work, professionalism into workplace and what you do, even though you're caring for somebody, but you're caring with respect, giving them respect, makes them comfortable. And I think it's one of those moments where that compassion sees through and your colleagues recognize you for it. I'd love to hear your perspective in terms of why you chose nursing to begin with, and give us your journey and what takes you every day when you wake up, and said what motivates you. I'd be curious about that.
I try very hard to connect with each of our patients to try to understand what it is that they're trying to achieve as far as their healthcare goes and what their fears are. A lot of the rheumatology, when people read about it, when they learn about the medication, some of those things are scary. So you we try very hard to present all the data to explain this is what the disease is doing for you, this is what's happening to your joints, this is what this medicine does. And even though it's listed as this type of medicine, a chemo medicine, and you read about the side effects, to help them understand that as a whole, a rheumatology patient is predisposed to these other illnesses. But with these medications, it doesn't mean that you're definitely going to develop those, and try to help them understand and see it from their perspective and what's important to them. If going to Walmart and walking around and getting to get out of the house is what's important, how is this medicine going to help them? And just try to keep it from the patient's perspective, what's important to them to get out of life, because it's not what I want for them, it's what do they want. And we really try to help people achieve that goal.
So Nina, whatever Debbie and Dr. Verma and his team can't do, and they try, and at some point the disease takes a toll, and sometimes it lands in your hand. So describe your day and your challenges and things that you want to communicate with everybody to know about your program. I'll be glad to hear that.
Well, a lot like the other nurses say, it's about the relationship you make with the patient. And right from the get-go, people are amazed at how bad it hurts. And we respect that. We know this is a shocker, how bad it hurts. And people say, well, when you do the pre-op class, you have to tell us it hurts. Well, and we don't highlight that, but some things that we do like to mention are things like, well, why did you have the surgery done? Everyone has a reason. Maybe it's so they can enjoy their grandchildren. Maybe it's so they can travel. And it's pain, and it's pain all the time, and pain is stress on the body. I think it's a very bad thing to live in pain all the time. So this is a huge step that people have made to try to fix this. And we really, when they get frustrated, we truly try to get them to reach deep and think, where are you going to be a year from now? This week, yes, it's going to be a bad week, and we're going to do our best to help you through it. But where are you going to be a year from now? Playing with grandkids, traveling, maybe going to the Grand Canyon, maybe going to Europe, or maybe just going out to dinner. I mean, people are in so much pain they can't go out to dinner. It's not enjoyable.
So Nina, let me start with you in terms of Nightingale Award and recognizing nursing and your colleagues and being recognized. I'd love to hear your passion come through in recruiting more nurses to the profession. I mean, this is such a giving profession. When you give, you get so much. And word of wisdom that you want to share and encourage others to follow the path that you're on, and just love to hear your thoughts on it.
Well, anytime I have a good waitress, I always tell her she should become a nurse. Because the right kind of waitress, yes, when they show caring and they're never hurried, or they're busy, but they're always pleasant. I always tell them, become a nurse. You got it.
Funny, I was a waitress before I was a nurse. There you go. Nursing is a wonderful profession. You meet so many people, you educate, you open your heart, they open theirs, and you give so much, but you also get so much back. And you work with wonderful people, with physicians, with doctors, it's been a wonderful career for me. And anyone who enjoys people, enjoys teaching, nursing is a great profession to go into.
I also was a waitress. We have a theme. For me, it's the choices that you have, to just all the choices that you can go down different paths as your career as a nurse. I mean, I started out thinking, I was a bedside nurse and I was never going to leave the bedside, and here I am as a nursing educator, and I'm still able to reach the patient as a nursing educator. I'm providing my staff and always encouraging them to use evidence-based practice when they're providing care to their patients. And your career can grow with you, and now I'm kind of leading my path into the primary care world as a future practitioner. So it really does allow you to grow, and kind of it's fluid, you know, you kind of move with the change. So yeah, I can't encourage people more than to choose this career because it's greatly rewarding.
I was never a waitress, but I like to eat. And I've often thought the same thing, because when you're a waitress, you're always checking in with everyone. So that, as you said, I think even if you're very busy, you have to kind of attend to everyone and make them understand that you're with them and that you have their back.
6 or 7 of your other colleagues who have been nominated with you have not joined us because of the scheduling and patient care related things. And I know it's been difficult for you to take time as well because I'm sure in the back of your mind you're thinking about your patients. So for others who have not made it, I'm sure you have done a good representation for them. We are equally proud of them as well as you being here and sharing your thoughts and your expertise and your time and word of wisdom. So just a congratulations to everybody in nursing who been nominated. If not nominated, you are working towards nomination at some point with the great service that you provide. I wanted to congratulate all the nurses on the Nursing Week as well as the Hospital Week. Thank you for what you do. We are successful because of you. Thank you.